special good morning to one and all. Welcome to today's edition of To The Point. It's Tuesday. It's the first day of October 2024. Yes, it's start of a brand new month. I could say that. Good morning to our listeners and viewers wherever you're at this morning around the world. Good morning to you also via social media platforms. Good morning and welcome. It's To The Point. I'm your host, GT. It's Opposition Tuesday here on the program this morning, and representing, let me say good morning, the opposition this morning. We have Dr. Clarice Modeste Cohen. I give her all the names in between. Right? All of them. Good morning to you, Doctor. How you do, Doc? How you doing this morning? Hope all is well?
Good morning. All is well. Thank you for asking. And I want to express appreciation for the opportunity to be on this program this morning to share some thoughts. And also I want to say good morning to your listenership here in the Tri-Island State and those who are listening on different social media platforms. And wherever you have listeners, good morning to all. It is a pleasure to be here.
All right. And it's always a pleasure to have you. It's always great having a conversation with you on the program. Once again, let's get the conversation rolling off this morning. Lots has happened over the last couple of days and so forth. Let's kick the conversation off this morning with the General Council that took place was on Sunday last. How was it, in your opinion? How was the General Council, in your opinion?
General Council was excellent. Really, really, really surpassed my expectations to some extent. I expected it to be really good, but in terms of numbers, in terms of the content of the messaging that was shared, I thought it was really good. And in terms of feedback from the attendees, it's not just my own opinion. It is getting us to where we want to be, getting people more sensitized to what is happening, getting persons more aware that we have to do our work to ensure that we will in our the buzzword or the buzz terminology was rescue Grenada, and so I think it was very good, and we are on a roll, and I expect the momentum will continue that way.
Okay. You used the buzzword, as you said, rescue Grenada. Are we at that critical stage that we need to be rescued, if you could say that?
Yes, I would say that. And some of the things that I will share would attest or would direct us to that. And those who know, they know. Those who do not know, my message here is just check it out. And if you do find out, then let's make our voices heard. Let's raise concerns. Let us let the powers that be know that there are concerns, and we are seeking, some redress, some improvement, some change in some of the areas which I will point out today.
Okay. And of course, my final question on the General Council this morning as we go through the program, so there were some statements made by Dr. Mitchell, the leader of the of course opposition right now, where he said that there are individuals wanting to, to destabilize the party. In your opinion, what are these statements? What are these statements that were made? How do you feel about that?
Okay,
in the context in which he spoke.
So yes, I like everybody else, I heard what Dr. Mitchell said. First of all, I want to say the only person who can clarify anything on that, or the best person, is him. But of sure, I have an opinion. It has been said, it has been spoken about, some quietly, some a little more loudly, that there is some bit of a disturbance, I must say, within the ranks. It seems to center around the leadership issues, and there's nothing wrong with people vying for leadership. I for one, I respect that. Secondly, I think it's a good sign. If you within a party and you want to aspire to be the leader, it means that you think well of the party that you feel the party has potential and possibilities to move forward. So I have no problem with that personally, with different persons. And I would like to see, because it's important that we have succession planning, that we take positive action to see how how ready we are when there's a change. And we expect a change at some point in time. And we should be grooming persons, I want to underscore, not necessarily one person. And there should be a chain of ideas for succession, so that if for some reason one person that we're thinking about cannot make it for whatever reason in the world, then there are others who can succeed and hold leadership positions in the party. And while the talk has been about the leadership at the top, we must not forget that in politics you need leaders.
Yes.
So I think that as we look at the succession for leadership in the party, we must also look for the ultimate leadership. Then we must also be looking at other people coming in. And as I mentioned that, I must compliment two young persons for stepping up to the plate, and that is Brother Dwight Horsford and Miss Mariana Charles. Yes. These are persons that I know. These are persons that I've heard speak, and I believe that augurs well for that. So while the busting is the ultimate leader, I think we are on a good wicket with that. And the fact that Dr. Mitchell could be open to leadership discussions, I want to compliment him for that. And the party is looking at that. It's good too, because for years we have not looked at that. We have heard persons talking about convention, yes. And the only most people who have concerns about the convention is, one, that we have not held it, and two, the leadership issue. But convention deals with a number of issues that are demanded by the Constitution, and therefore we have to put things in place to ensure that we comply with the dictates of the Constitution. And I would like to see people, while they focus on the leadership, look at other issues that we may have let kind of fall by the wayside in the Constitution. Thank God it's not many, but they are important. And so I want to add here that we do have a team that have been looking at these things and working to make the appropriate changes. So and some of that was brought up in the main one was brought to the attendees at the General Council. So all in all, I think it was a well-rounded General Council.
Now, NMP, of course, as a political party, has gone through different phases, of course. What is different about it this time around, being in the opposition this time around? What is different about the new National Party from all the phases that has gone through, from being in government, being in opposition? It's not the first time. What is different about this particular, phase that they're in now? In comparison?
I sort of alluded to it, but I'm happy you asked that, because over the, how many years, 40 years, 30 plus years, there has been no issue about succession or change in the ultimate leadership, the head of the party. And now it has become an issue. One, because the political leader has expressed his intention to step down, and two, because now other persons are expressing interest in stepping up to the plate. It is also a difficult time being in opposition, because if you're in government, the succession is easier. Persons who are interested can be given certain roles, because not only do we have to think about leadership of the party, but we have to think about leadership of the country. Yes. And therefore, if you're in government, there's that opportunity that you can give to persons to prove their mettle. I should say. In opposition, it's not the same, but opposition gives an opportunity. It's a challenge for persons because now you're in a situation that is different. We're looking for a leader. We're looking for persons with the competencies, the will to do that. And so they have to find innovative ways now to demonstrate their capacity and their leadership while not in office. So it's an interesting time for us.
All right, great. We drew for a break. Let's take our first break. We're coming right back. It's to the point here this morning. We have Dr. Clarice Modeste with us this morning, representing the opposition here on the program. When we come back, we get more into the discussion. Stay with us. Don't touch your dial.
GBN is your home for this year's Republic Bank CPL. Please note there will be adjustments to our programming lineup on Tuesday, October 1st, Wednesday, October 2nd, and Friday, October 4th. Transitions will air at 5:05 p.m., followed by GBN Television News at 6 p.m. And don't miss the news repeat right after the CPL match. Transitions will also be rebroadcast after the news repeat, so you won't miss a thing. GBN, bringing you sports coverage anywhere and everywhere. Looking to take your business to new heights? Advertise with GBN on our social media platforms and get noticed by our 138,000 plus followers. Reach a massive engaged audience ready to connect with your brand. No matter your business size, GBN is here to help you grow. Contact us today at admin@gbn.gd or WhatsApp 407-8458 to get started. This holiday season, get ready for a magical celebration packed with culinary delights, crafts, and music that will bring joy to your heart. But that's not all. Lots of giveaways are waiting for you. Stay tuned and make this Christmas one to remember only with GBN.
Welcome back to our listeners and viewers once again. It's to the point. It's Tuesday, the first day of October, the month of October. Interesting month in the history of our beautiful tri-island. Dr. Modeste, welcome back once again.
Thank you.
Let's get into the conversation. Of course, this segment of the conversation is going to be of really interest to you. You being a medical doctor yourself, so health is always something that you will put to the forefront. You yourself has been a minister of health here in Grenada, so you know it's something that will touch you personally, knowing the situation that we're at in this country as it relates to healthcare. Now, Doc, with the health sector in Grenada, there's lots of concerns with it lately. We've been hearing of, recent deaths of babies, speaking out of, family members as a result of the inefficiencies we've seen at the General Hospital and other, of course, health institutions around the island. In your opinion, as it relates to these issues, what is going on? What is going on as it relates to that?
Okay. Very interesting question, but during the break, something came to my mind. I just want a couple seconds to mention it. And that is today there is a beginning of a 2-day conference on sargassum seaweed. In the country.
Yes.
Of course, hosted by the government of Grenada. And I think it's a wise move by the region. I expect there would be persons with years of technical experience there to support, whether the local and especially abroad, to see how we can deal with it. It has been a plague for our country and many other countries in the region, and so I think it's a very good initiative to get this, to host this meeting, and I hope to hear some things about it. I would have liked to attend the opening ceremony, but the opening ceremony alone doesn't do all, and I don't know if any one of my colleagues have been invited to some of the sessions, but I think that is a role that opposition can play, not just go for the glitzy part of it, the opening ceremony, but be part and parcel of the rolling up sleeves and getting into the discussions. But it's a good move.
All right.
Yeah.
I certainly will be happy if it's get tackled.
Yes, it is a big problem for us.
Some positive results coming out of it, because you know what it's like when it of course comes to show,
goodness.
and the tension so it brings out is sometimes uncomfortable to be in the particular surroundings or areas where it of course settles a wee bit. So going back to my question as relates to health, the session as I mentioned,
yes.
of course, if you want to remind of the question, or you will probably remember.
We are going to health, so let me go into health, because that was not my first bit there, but it perhaps should be, because it is so important. Some of the things that you sort of mentioned, they are concerned to us as opposition, but as patriotic Grenadians and as human beings, because when there is or there appears to be suffering somewhere and hurting on persons, then it is a cause for concern, a major cause for concern to all of us. We've heard a number of infant deaths, and it would be interesting to see what our statistics are, what our ratings would be at this time, because I think an infant is up to about 12 months,
yes,
from birth to about 12 months. And then they do a ratio which compares the number of infant deaths to every 1,000 live births that you have. So, and countries worldwide are rated according to that. So the more infant deaths you have, your ratio would increase and all of that, and that's not good for us. And so I am concerned about that, but more importantly, I'm concerned about the root cause. Why does there appear to be an upsurge in that? Is there some type of infection, some type of disease that we have not heard about, I have one relative who is a nurse, and she often informs me of new outbreaks of different things in the U.S. It's in the news, and what demographics is it affecting most? What age group, yes, and so on. And some of it affects infants and children more than it affects others. Some of it affects more than others. So I don't know if there's something that we have not picked up. Is it the quality of care that is being given? It is something that has to be looked at. Is it lack of certain supplies that are not available for the caregivers to use? I don't know. This is something that needs to be looked at. And it is even more disturbing because I have not heard, and you more in the media than I am, of any serious move to deal with it. So, for example, it is a fact that medication is scarce. People come to me and ask, could you help with this? Could you help with that? So on and so on. And I do when I can, sometimes from personal means. We do have the constituency fund at this time that we use, I use to assist persons in some ways. Some persons, they have to buy it. And if persons can afford, I have no problem with that. But disease doesn't affect people by your financial status. It just affects people. And so there should be some safety net, well established, well known by persons for to protect those persons who cannot afford. In our time, the Ministry of Social Development had a program that used to assist. I don't know if that is still really working as it should, but it's something that, if it isn't, need to be stepped up on. So the deafening silence from the authority, it bothers me, because one child died, two children, sorry. You can work it out with your staff, you can work it out internally, you speak to the family, and that's where it's, because everything doesn't have to be a news headline.
Yes.
But when the numbers begin to increase, then we need to start hearing, look, we don't know what is causing it, but we're investigating it. We're having sessions on it. We may feel it necessary to invite other regional entities to assist us with the technical expertise to assist, and there are such entities like Pan American Health Organization. There's a research center in Trinidad. It's CAREC. I think it's CAREC. And so on and so on. And there might be individuals with the expertise. So let us know what's happening. Then, on the other hand, there are issues of maternal deaths. So I've heard about mothers dying,
yes,
either during childbirth or right after childbirth. Then if the numbers, there may be situations, and I well know of some situations where things can get out of control. But what is causing it? What is the cause up to now? I have not heard. So I have heard no investigation declared. I have heard no reports. And families are clamoring to know what is happening. They need to be taken seriously. I mentioned the shortage of medical supplies. And we had a sitting of the finance committee of the House, and we were looking at the supplementary, and I saw quite a lot of monies allocated for different things, and monies needed to be allocated for most of the things that were mentioned, but I was disappointed in the amount that was allocated for health. I think it was 5 million.
Yeah.
It was 5 million, and given the extent and the gravity of the situation in terms of the shortage, I expected to hear more about for that. It's still possible to change it because health is so essential and critical. So I would like to hear some more about it. Those shortages, what are we doing? And there is money now. I don't want to go into it, but I'm sure they could take some from the CRIF money for health insurance, for disaster insurance, because you can't fix disasters if you don't fix the most important disaster, which is a shortcoming in your health area. And we have heard that there's been quite a lot of monies coming in from the CBI. We certainly know that the numbers of CBI recipients have increased significantly over what it used to be in our time, but I have not heard anything. Money's coming from customs, so some more monies need to be allocated. Whatever is the cause of the problem at this time, the government needs to step in to fix it, and they need to let us know, because this silence is making people apprehensive. You hear persons saying they don't want to go in the hospital. Persons go to private institutions, notwithstanding the inability to even meet the finances that they have to go there for. So other needs of the home, of the family, have to be put aside so that people can go elsewhere. And that is not good, because I know we have excellent nurses, excellent physicians at the General Hospital, and that even some who are there, they are in the private institutions as well. So we don't always have to go to private institutions. I'm not saying don't go. There are certain accommodations that you can get there that you don't get in general. But certainly the amount of persons who find themselves having to go there is becoming a cause for concern, because some of them can ill afford it. So with all of this, my take on this is that, one, the shortages of the medical supplies is easy to deal with because there is money to deal with it. Two, we need to investigate why the infant mortality rate and the maternal mortality rate, what is happening to it and why, and to seek support wherever it may be. Third, the families need to be engaged, talk to them, make them understand. But we must see the will of the government to do something. And the ministry and my dear colleague, the Minister for Health. We would like to hear him. Tell us something, talk to us. And the people who are hurting the most, engage them.
Okay. All right. My next question goes, we hear there's this conversation going around about the morals of doctors and nurses, at our health institutions are pretty low. What do you think are such causes for that?
Well, the first one I mentioned was supplies. If you don't have the materials you need to do your work, then you have a serious problem. No matter how good you are, there comes a point in time when you need medication, you need some instruments, you need some things to do certain things, and that could be very frustrating. I also think the shortage of staff. And we have heard over time, I don't know exactly how many, but they're in double figures of people traveling. And the grass appears to be greener on the other side, the United States, UK, and I don't know wherever else, it appears to be greener. And so the work becomes more burdensome. There is shortage. And so I think something needs to be done about it. I remember we've had it. It's not new, and it perhaps won't be the last we hear about it. And I think, one, we need to look at the training of more nurses, but we also need to look at how we retain them. And one of them would be having them sign a bond. If government supports people financially and otherwise to get training, I believe that it's a moral duty to give back some time to the country, whether it's 2 years, 3 years, 5 years, and then you can go. That is the other thing. So that. Then thirdly, maybe some incentive. I don't know what the unions have been discussing or what government has been discussing with staff, but to listen to them and an incentive. Usually, most times incentive is money, yeah?
It's true.
Most times. And that's what it is. And then
you can pass other things to that.
There might be other things.
Yes.
Like health insurance, like certain things, that should any harm befall them, then they and the family could have recourse through the system. So it's not always financial, but there might be better conditions for working conditions. So dialogue needs to be held now in terms of what can we do. The monies would be limited, but there may be other things that can entice nurses and doctors to stay. So I hope we can do that. And perhaps one of the last things, because at this time I didn't think we would have had to do it after so many years of training so many physicians, but we may have to turn to Cuba, see if we could get some relief for staffing for nurses and doctors.
But there's also a huge amount of Cuban doctors already.
There are, but if you have shortage, and maybe we need to look at the terms and conditions under which they are employed. How long do they stay for? How long do they stay in the public service for? So there has to be some dialogue, some kind of arrangement, because if persons come in and after 2-3 years they gone private, then you still have a problem.
Yeah.
Still have a problem on your hands. Right. So maybe the dialogue needs to be had.
I would like to ask this. Of course, we know of the health situation in Grenada. As you mentioned earlier, it's nothing new to us as an island. There's nothing new. It's nothing new. We all been having health problems. But in your personal opinion, being a medical doctor, being a Grenadian itself, and of course being part of government yourself, also being an individual who was of course a minister related to of course in charge of health. What do you think is seriously need to be done to healthcare to bring it back to a level of stability in Grenada? What do you think that should need to be done? For the unstable way that it is right now, we need to have a level where healthcare becomes stable to a point. What really needs to be done?
Well, stability is very difficult to achieve. So I don't want to come here to try to be the expert on that, because, no, I'll tell you why. If you listen to the United States or England or major countries that are having major countries that are going into elections, health is often the a major issue.
Yes.
Healthcare. I understand some of the nearer home that is being discussed on local levels on other islands as well. So, because the thing is, when you fix something, something else gets broken. You fix the X-ray, the ultrasound gets broken. So, but some measure of stability could be achieved. I think I mentioned some things already, but in our time, one of the things we did, we started a customer care support in the hospital, where we got volunteers to go into the hospital. Some of them retired professionals and so on. They would go and be the customer's advocate, the patient's advocate for certain things that they may need, maybe even speak to the nurses or so if that person has a situation. So you go into the hospital and you find out, because sometimes you may hear, well, look, I'm calling for something, a bedpan or so, and I haven't had it. So to be the advocate, but to assist as well. Because if you're short, you need persons to assist in bathing, in doing certain things, reaching a bedpan. And with a brief training, persons can be taken to the point where they can do that effectively without interfering with the staff's work, but enhancing the work that is done there. I think that is one of the things that could be done. I remember when we built the General Hospital, one of the facilities that were put in the design was a room where the doctor could meet with families. Yeah. And explain certain things. So that, because sometimes you just go anytime, and doctor might be in surgery, doctor might be in rounds, and you wait endless time. But if you want it, then the waiting is worth it. But there is somewhere where the patient the family, the person who is inquiring and has a right to do so, can sit and wait, and somebody can say, well, maybe you can go into town and do something because you have a 3-hour wait, something like that. But some customer service need to be taken on board. And as I said, supplies. You make your staff happy if they have the supplies to do what they need to do. Okay.
As we drew for a break, and as we come back, we still have much more to talk about. Let's take a break, folks. We will be right back, and the opportunity for listeners and viewers, if there are a question or two, when we come back in the next segment. Stay with us. Don't touch it now.
It's never the wrong time to prepare for a hurricane, and we want to make sure you and your family stay safe. You must take an active role. It only takes one hurricane to change your life and your community. Hurricanes are one of nature's most powerful and destructive events. That's why a hurricane preparedness checklist is vital. You should have a family evacuation and communication plan. Everyone in your
listeners and viewers, welcome back. It's Sort of Point here on the Classic Radio GBN TV. With us this morning, Dr. Clarice Modeste, representing the opposition this morning here on the program. Doctor, of course, Dr. Modeste, I want to get into a conversation, of course, about the recovery process from Hurricane Beryl in terms of our sister islands of Clarice and Petit Martinique. There's still a lot of issues out there that's of concern to we as regular Grenadians. You will be part of the opposition. What are some of these concerns that still continue to fester away that brings a level of concern to you, especially when it comes to recovery? Yes, we have gone from the relief stage. What are some of these concerns that are still embedded to you a wee bit?
Okay, so I will not belabor this issue too much, because a lot has been said, and most of the deficits and the concerns, they are well known.
Yeah.
But it is still a concern, and you mentioned you asked about General Council in the beginning. It just reinforced to listen to Senator Cox. Some of the trials that continued and the uncertainty, because people in Carriacou and Petit Martinique and mainland to a lesser extent, we're listening to hear a plan roll out, a plan with timelines, what is going to be done, when it's going to be done. And the Carriacouans say that they have not heard that.
But there has been some incentives that's been rolled out by government.
Okay, so...
For instance, the free barrel and so forth, incentives to farmers and so forth in terms of the cash incentive, of course, to help them recover, or they may have lost and so forth. Some of these incentives were rolled out.
Well, the free barrels have been.
Yeah.
And I think it's up to the end of December.
End of December.
To my mind, they were a bit late. When I'm comparing.
Yes.
And I'm comparing, and I won't call country name or so, but I'm comparing what happened elsewhere, right? And it didn't. All it had to take was a stroke of a pen, so that could have been done quickly. But also in terms of the farmers.
Yeah.
And Carriacou does have a bit of farming, but I'm addressing largely on the mainland, but as well as Carriacou and Petit Martinique. Some of them are still complaining. When I last checked, which was a few days ago, they were still waiting on the end of the month promise. I don't know how much that has been fulfilled, but it has not. I don't agree with you. It has not. That part has not rolled out, because farmers were told end of the month. Some were told later on October, so on, and they have some concerns. One, they need to clear the land because the vines are taking over. They need the support, whatever monies government is giving to them. I won't argue the quantity now, but they need that support. And some of them have started, those who have, and what they had is fast running out, and some are waiting to start. So, and the vines are taking over because the rains are coming. So that is one thing. So if it has started, it needs to be fast-tracked, because some of them would have liked to clear and start to plant before December, before we start looking at the dry season. I am also concerned about the food security of our country, because with some farmers unable to start, and the supply is not enough for the demand of local foods and vegetables and your cabbages, your breadfruit. I saw one breadfruit with a $15 mark on it, and I was blown away. I was shocked to see where we have come. But that is what happens when you don't have the supply that you need. Prices of different things, tomatoes and so on, is going up. But the quantity is not there. I have gone to supermarkets and some of the frontline ones and the little shop, and sometimes I pass by the side of the road and I pick up things, and you stop and you want certain things. I noticed the limes are coming in now, but for quite a while we didn't have. But there are a number of things that are just not there because the replanting has not been as it normally does. And I don't see, and farmers are saying they don't see a sense of urgency because today's the first?
Yes, the first.
Today's the first. So that we're talking 90 days.
Yeah.
Just about. And they have not seen that sense of urgency, and they are concerned. So I think this is something that we have to look at in our Tri-Island state. The fishermen, likewise, there was some allocation for them. I have not heard, I have not seen it in the news, but maybe something has happened that if it has not happened, we need to push that as well. So these are my two main concerns in terms of the food security and the rollout of supplies to the farmers, because while the money is there and they're waiting, they're losing hope. And I see it, I hear it in the voice. I just want to mention one more thing, and that is I've been hearing more and more about the school feeding program. That the monies for the school feeding programs has not been forthcoming. So it's something I just want to raise. I don't want to go into discussion about it, but we know some children, some families depend on that for the children to have a meal during the school hours. So I just wanted to mention that as well.
Okay. 4352041, that's the number. Of course, we have a few more minutes left on today's program. If you do have a question or two you would like to ask Dr. Modeste, feel free to do it in this segment. And let's go to the phone line and see our first caller. Caller, you're welcome. Good morning, and you're live.
Hi, good morning to you, GT. Good morning to you,
Dr. Modeste.
Dr. Modeste, whom I know very well and love and respect. A couple of things. I feel for the people in Carrico and Petit Martinique. They're in my prayers every single day. And nothing can be done too quickly for them. They really need it. But it seems to me that in terms of the government, damn if they do, damn if they don't. Yeah, they opened the schools. There was a clamor for schools to be opened. Now I've been hearing they opened too soon. They could have waited, and because people are using the school for shelters. So sometimes there are a number of situations where decisions have to be made, and we cannot win them all. Quickly on the matter of the health care, I'm very, very concerned. And as Dr. Modeste cited out, that some of these problems, most of them are not new. They are ongoing problems. We must have the infrastructure. We must have the people. And they are very short in terms of the doctors and nurses, the caregivers. And we must have the medications. So these are basic things. Now, in terms of the cases that have been mentioned, I am not hearing certain things which I will need to know. Are the children who are dying, are they children who came in well and got ill at the hospital and died? Or are they sick children who were given birth to and didn't survive? The same thing with the mothers. Are the mothers, were they healthy mothers? They did all the tests, they checked out well, and then they went to hospital and then they fell ill. I'm hearing a lot of talk about since COVID and the vaccinations, we're seeing a lot of certain deaths, a lot of changes in dynamics of health. So I think we need, for us to be able to analyze the situation carefully, we have to deal with it quickly, and we have to see what the problem is. But we must analyze it. Who is getting sick? Who is dying? Is it happening at the hospital, or are the people coming in ill? And, of course, the level of care and the medication and so is also very important. But does Dr. Modeste have any information, any data on which categories they fall into? Thank you very much.
Thank you, caller. Thank you so much. Any response to the caller, Dr. Modeste?
Thank you, my dear friend. I kind of smiled a bit because we go back a long ways and we have mutual respect for each other. And your contribution today makes me have even more respect for you, if that is possible. No, you're quite right. That's why I haven't gone into details concerning Carrico, because we know what has happened. However, You notice that I stayed away from saying if the schools that are open are too quick. I don't subscribe to that. Persons may feel so, but you will agree that after 90 days, there should be a plan, some kind of contingency plan, and some action behind it to remove the people who are still in shelters. And I'm hearing that there are not many, because kudos to Caracuans and Petit Martinicans. A number of them, I understand, have taken persons into their homes. Those whose homes are a little bit better than others, they have done that. And but we need to move quickly for the children. I'm sure you would agree with that. We need to ensure that they go back to school. Otherwise, they could probably lose a whole year. Before you know it, they're going into the primary school children will be doing their exams. The secondary school children will be doing their exams early in the new year, and therefore they need that kind of support. So we have to hasten. We have to hasten, and we have to hasten to get persons out of the schools that are shelters. In terms of health, I have just mentioned some of the things I think that could be done, and they are in support of what you say, or what you said is in support of what I said. Finding out what's the state they came in, and all of that. But sometimes you can either use the technical expertise that you have in country, and I also mentioned that outside there are always agencies, regional and international, that are willing to come in and help. However, once your numbers start in exceeding a certain average, then there's cause for concern. We cannot just presume that they came too late or they came ill or whatever not. There is obvious cause for concern with the numbers. And I've stayed away from numbers because I don't have an exact number. But the frequency with which I hear it, and it's different children, different parents, different locations, shows that it is probably happening too often. So it's something that we need to work on. And the people that you know very well, they will always tell you that I have said I am willing to help. I'm not the expert, but I'm willing to sit down in a discussion and to hear what people have to say and put a little salt where I can.
Okay.
But I'm willing, just as I jumped in with COVID, I'm willing to do that. But we need to do something now.
Okay, we do have another caller. Caller, good morning, and you're live.
Hello, good morning.
Good morning
to Dr. Modeste. Dr. Modeste, I remember under you all watch, you all had so much young people graduate, sometimes 500. Could you please tell us how much of the graduates that this government hire, and how much you are prepared for the work? Because I'm hearing now that they have jobs, but the labor force, they have the people to do the work. And if I in this country and I see so much young people graduate over the years, you all here, and we're searching for workers, something wrong. Could you tell us, please?
Thank you, caller. Thank you so much. Hope you understand the caller's question.
Yes, I think I understand, and I'll endeavor to answer. First of all, I want to say categorically that because if something went wrong before, that is no justification for us to say, well, it used to happen before, let it happen again. So I want to tell us that we're in a phase, and we need to deal with the present situation. The government that is in office now needs to deal with certain situations. Secondly, if there are persons, so many persons as you have admitted, that were that graduated, and we're proud of our track record that we have trained a lot of people, then it's up to the government to employ them now. And wherever there are gaps in the training or in the expertise needed, then let's train them now. So I recalled, even when we were turning out a lot of graduates in different areas, there was a study done by the University of the West Indies that we supported in Grenada to look at where the knowledge gaps were. And were we training them in the right area? Are this the area that Grenada wants? Are this the area that the world wants, so that you can export? Because we must think about export sometime too, although I don't like it. I like to know that our people stay here, but that's a reality. So let's not look, I'm not looking for blame. I'm just saying let's do what we can, because there is an obvious shortage of staff at the general hospitals.
We do have another caller. Caller, good morning, and you're live.
Good morning, brother, and good morning to your guests. I heard you say a little while ago that some farmers start getting money, and I believe that is a lie. First of all, GBM must investigate, because I talk to big farmers from St. Andrews, La Poultry, St. Patrick's, and nobody gets any money. So when they say some farmers get, well, who's the some? Because I believe that's a lie. Nobody get money yet. I think GBM should investigate that. Have a nice day, brother.
Thank you. Thank you so much, caller. We do have another caller. Caller via WhatsApp. Good morning. You're welcome.
Good morning, GT. Good morning, Dr. Modeste.
Good morning.
Good morning.
And, Dr. Modeste, the last time you was there, you asked me to do my research. I don't know if you remember that voice. Well, I did my research because I spoke about the highest in poverty level, and I said it was St. Mark's. You tell me you guys went up. Well, you guys didn't went up. You're still the highest. We spoke about the shrimp farm, and then also you said it was CBI money. I want you to explain that for me, because CBI money, meaning that we sold passports, so that means it's our passport money. So maybe you could explain to us what happened to the $50+ million that was invested into the shrimp farm, and also maybe you could explain to what happened to our 19 million plus into the fall farm. Okay, my question to you now again, that you've been around Peter David, and you know Peter David put up himself that is interested in the leadership, also MLMPA. But we realize from since the time Peter David put up himself, Dr. Mitchell having sleepless night, going onto the platform, bashing him, and we see happening in front of you guys last Sunday, because I follow you guys meeting every Thursday and Sunday. You know what I mean? And you guys stand up there. You know what I mean? I want to know that if you guys won't take any action against Dr. Mitchell for bashing a member of your team. And you've been around Peter David and you see the leadership qualities that he have. Do you think that he have the leadership quality to take the NNP into the next election? And if Peter David put up himself, would you be voting Peter David, seeing that you've been around him? You see the action that he take in Parliament. You guys walk out. He was there with you. He stand up with you guys. He served with you guys. So I want to know that. My last question to you now. You was on the platform, a couple platforms, in you guys meeting, and you've been bashing the government about they take a pay raise. As soon as they reach it, take a pay raise. Dr. Modeste, you mentioned about the pay raise. Let me ask you, didn't you guys receive also a pay raise from the same government you're bashing about they take a pay raise as soon as they get in? These are my questions I would like you to answer, and I want to know that if you will be a candidate in the next election, would you be taking part in the next election?
Thank you, caller. That's a lot of questions there.
Yes, that's a lot of questions. I wouldn't attempt to answer all. I think you have taken an unreasonable length of time with your questions, caller. First of all, I want to say I am the messenger. So you talk about bashing, you have tried to bash me. But I'm the messenger. Don't bash the messenger. Let me see. You spoke about the fowl farm. You need to ask NDC about the fowl farm, because when NDC came in office in 2008, the fowl farm was very viable. The project was a viable project. It hadn't started yet, but the project was viable. The money for the fowl farm was in an escrow account for which government was responsible. You can ask them that one. One of them might remember what happened with it. In terms of other things, in terms of CBI, there are some people also who are experts in that. They are agents. You can ask them about how the CBI works. And then, because I cannot explain that here, the time doesn't afford it. I am not that involved in CBI. But ask them how the CBI works, and then you will understand that the money that went into the fowl farm was not government's money. So you need a little lesson on that. We need a little lesson on that, and it will take longer than what you ask. Now, one challenge I have for you, I want to take you around St. Mark any day that we can agree on, and let us look around that place and ask people in the area what that place looked like years ago. That is my challenge to you, because the proof of the pudding, well, seeing is believing, and over the years, a lot has happened in St. Mark, but I don't have the time to say that here. I am proud of what we have done. There's always room for improvement. So any advice you have to me or whoever will succeed, when the time is appropriate, I will let that. In terms of Peter David, we are in the process. I never heard Dr. Mitchell mention anybody's name. So you must be very informed, higher than I am, because I have not heard Dr. Mitchell mention anybody's name. But also, we are in the process of succession planning. And you're asking me now to make a choice at this time when there are contenders for a position. I will not honor that question. Thank you.
We may have our final caller this morning. Caller via WhatsApp. Good morning, and you're welcome. You're in your live.
Hello, good morning to you.
Good morning.
Dr. Modeste, representative for St. Mark. I think Dr. Modeste may be close to probably 60 years. And she served with a number of persons in Grenada in government who are within the age of probably about 75 to back down to about 40 years. Does Dr. Modeste and those individuals know anything about a joint account? How is it that people who has doctorate, they're mathematician, they're medical doctors, they have business, they own property, how is it they don't know about joint account? So the cock and bull story where passports were sold and approximately $52 million is unaccounted for and there's supposed to be an investigation is, what I should say, children's stupid talk, because you should have had a joint account so that you protect investment to Grenada, sale of passport, bring in money, but we can't find the money. There was no joint account. One man probably run away with it. Really? That same person had his office close to the Consulate General in Toronto, somewhere on Yonge Street. What is Dr. Modeste telling us? They don't know what happened to those monies that were invested in passports through Surrender Woody. We had, for example, a big opening ceremony in 2018 where I think a prime minister was there and a representative was there telling people that they're going to get shrimp farm and nothing developed. Dr. Modeste, give us a better answer than that. Please.
Thank you, caller. Thank you so much for your...
Do I have time to just say one thing?
You can go ahead.
Okay, just one quick... Well, yeah, just one quick statement, sir. In terms of the monies, where the monies, that was one of an example of growing pains. The CBI was still young when that happened, and because of that, measures were taken by our government to ensure that that couldn't happen again. And that's why you came with a escrow account, and there was approval from the CBI entity to allow, based on work turned out or money spent, to allow those persons to draw down from that money. And that is what your government is enjoying at this time. So they don't have excuse for paying out to a big investor, to an investor who did not spend his money. They have absolutely no excuse for paying out an amount of money and not explaining to Grenadians. At the time, we didn't have the escrow, but it's there.
All right. Dr. Modeste, I want to thank you a whole lot. I'm not sure if there's any closing comment you want to make before we take a wrap for today's program.
No, not much, but just to say thanks for the opportunity to share. To all of the callers, thanks. There's always food for thought in what they say and what they ask, and I appreciate the calls, but some do not have the relevance that you expect, but that is life, and I wish everyone well. I wish Grenada could flourish regardless to the government in office, and I wish Carriacou and Petit Martinicans the very best, and our farmers and our children in school and the unpaid public servants. I wish all of you well and that things would happen.
All right. I want to thank you once again. I want to thank all of our listeners and viewers this morning, those who contributed towards the program. Thank you so much. Join us again for another edition tomorrow of To The Point. Have a good one, folks. That's where we say goodbye. Have a good day, folks.